Today we're going to talk about 3 questions you should go ahead and ask anybody that's providing cell-based therapies to you. I read a recent article in the Journal of Knee Surgery in 2018 by an author by the name of Dr. Puzzi. He was from the Cleveland Clinic. And he also looked into this too. He looked at 317 clinics. They ended up interviewing about 273 of them. And they posed as a 57-year-old male, which was dear to my heart since I'm 57 years old and has a knee problem. And they went ahead and asked the same question to each one of these clinics. And they had a wide variety of answers, a wide variety of their outcomes and wide variety of the costs. And they found that there was no correlation between the cost of the procedure and the overall outcome. And thus you really didn't get what you always paid for. And I believe that's due to the fact that there's a lack of standardization. So you as a consumer can help us form this standardization by asking these 3 simple questions. The first one is, what type of cells are they using? Number 2 is, what is the pre and post treatment protocols? And 3 is, what's your experience and what's your outcome? So we'll explain each one of these. What type of cells are used is very important because you can get stem cells from almost any part of your body and almost anywhere. All animals have them, humans have it, and all parts of your body. But the FDA says that the only ones that are allowed to be used are ones that are minimally manipulated and are for what is called homologous use. And basically what that means is that you have to take the cells as they naturally are, and you had to put them back in an environment where basically they normally come from. So after a review in a document that was in November of 2017, the FDA looked at all these different questions. They tried to walk this very fine line between trying not to overregulate and still allow physicians to practice medicine. And basically they said that only bone marrow derived cells that are taken from your bone marrow and given back to you without any manipulation are considered to be the safest and only allowed type of treatment. So other cells that come from fat, from someone else, where they're taken and they're grown and then given back to you, or if they were taken from amniotic fluid or placental fluid, are not allowed. And you may say, well, I still see these around. Why are they still around? Mainly because the FDA said that they're giving everybody a 2-year grace period to basically straighten up and do what they're supposed to do. And then after November of 2019, they'll start issuing letters. So it's important for you to ask what type of cells they're using. Second of all, you have to go ahead and ask them about the pre and post treatment protocols. Any physician or clinic that says that they specialize in a specific treatment will have a very defined set of pre and post treatment protocols. Anybody that says that they replace knees or they reconstruct anterior cruciate ligaments will have a very specific set of pre-treatment protocols and post-treatment protocols. You have to look at the whole person. That these cells are just that, they're cells. They don't straighten bones. They don't go ahead and magically give you strength. They don't magically improve your balance. So those are things that have to be addressed, and not only of your knee joint, but also the joint above and below that. Because as the old song goes, the hip bone's connected to the knee bone, which is connected to the ankle bone, because we are human beings. We all need these joints. And if one joint is dysfunctional, other joints can be dysfunctional, and those have to be addressed. So things like bracing and pre-treatment physical therapy, heel wedges, shoe wear, and even nutrition have to be addressed as a total package. If a center just wants to go ahead and inject you and then grab your credit card, go someplace else, because you need somebody who's qualified to look at your joint, to assess your joint properly, and provide you with a comprehensive program. And then thirdly, experience does count. We know this from a lot of orthopedic procedures, that there seems to be a repetitive pattern of skill. Looking at training residents and training young physicians, it seems that you need a bare minimum of at least 50 procedures on that same joint with that same procedure to be skilled. And to be an expert, you really need more than 1,000 of those. So you want to go ahead and ask how many they've done of that specific joint in that year, and you want more than 50. And you want that person to have at least 1,000 underneath their belt before they can be called an expert. Also, those physicians that claim that they are an expert need to continually monitor what they're doing. We're just like artists. We need continual feedback of what we're doing and how we're doing it, and are we making improvements? Because this is a continuum spectrum. We're always trying to improve. Even if we feel that we got great results, we want those results better. So that clinic should be monitoring what they're doing. So they should be looking at surveys of how you started out, and then periodic review of how you're doing, and be able to review that with you and show you that you're improving. Or if you're not improving, what do we need to do to make it better? So they should have some form of reporting of where this patient started out with and where they end up with. Otherwise, they're not really serious about what they're doing. They're just doing this just to do it and not really interested in how to continually improve the process. So in summary, you want to look at what cells they're using, what's their pre and post treatment protocols, and what's their experience, and how do they follow up on patients. This way, we keep everyone honest, and we continually improve this treatment so that everyone can benefit. These are your cells for your healing.